Most people think hospitals are the safest place to be, but on February 19th, 1994, one woman walked into a California emergency room, and within minutes, doctors, nurses, and medical staff began passing out around her. This isn't a horror movie, it actually happened. Her name was Gloria Ramirez, and to this day, no one can fully explain what happened inside that hospital. Gloria was just 31 years old. She was battling advanced cervical cancer and was rushed to Riverside General Hospital after experiencing palpitations and severe breathing problems. At first, everything seemed routine. Doctors began treating her like any other critically ill patient. But then, one nurse noticed something strange. Gloria's skin had an oily sheen covering it. Another noticed an odd smell coming from her mouth. Some described it as garlic. Others said it smelled like fruit, almost like ammonia. Still, nobody thought much of it until a nurse drew blood. Floating in the blood were tiny crystal particles. Moments later, the nurse became dizzy. She couldn't breathe. She fainted. Another nurse rushed over to help. She collapsed too. Then a respiratory therapist, and then another doctor, and then some more nurses. One after another, healthy medical professionals were dropping to the floor. Some had muscle spasms, others couldn't move their arms or legs. Some temporarily stopped breathing. One nurse spent weeks in intensive care. In total, more than 23 hospital employees reported symptoms. 5 were hospitalized. The emergency room was evacuated. Patients were rushed outside. A hazardous materials team was called in, and Gloria Ramirez died during the chaos. But the nightmare was only just beginning. What could make trained professionals collapse simply by treating one patient? Was it a chemical weapon? Was it toxic gas? Something contagious? Investigators searched for answers. One theory claimed Gloria had been using a pain relief chemical called DMSO. Some scientists believe oxygen during emergency treatment somehow transformed this chemical into an extremely toxic gas. Others argued the chemistry didn't make sense. Independent experts challenged the entire explanation. Then came another theory, mass hysteria. Some researchers suggested panic spread through the emergency room, causing people to believe that they were sick. But critics pointed out something important. Mass hysteria doesn't usually send people to intensive care. It doesn't explain seizures or temporary paralysis, or why some staff became seriously ill while others standing nearby felt perfectly fine. More than 30 years later, the official explanation remains heavily debated. Some believe the government covered up what really happened. Others believe a freak chemical reaction occurred that science has never been able to recreate. And others think we'll never know. One woman entered the hospital looking for help, and somehow she became the center of one of the strangest medical mysteries ever. So here's the question. If you had been one of those doctors, would you have stayed in that room or run the second people started collapsing? Let me know in the comments, because this case still doesn't have an answer everyone agrees on.